Level B1 Pre-Intermediate. Consequences of childhood psychological trauma in adulthood. Crises, stress, trauma. Me and my child. What happens to us in childhood often has a big influence on our whole life. We think we create our own destiny, but in many cases, we follow a script written for us when we were children. Unfortunately, these scripts do not always bring us happiness and well-being. Often, childhood experiences lead to psychological trauma, which can negatively affect our life. Main causes of childhood psychological trauma. Divorce of parents, especially if they argue in front of the child for a long time. Death of a close person, usually a mother or father. Physical attack or abuse, including sexual abuse. Emotional humiliation, such as bullying in school. Long-term illness. Serious mistakes in upbringing by close adults, often the mother. Unhealthy family relationships. Traumatizing relationships between adult and child. One of the most common but hidden factors of childhood trauma is incorrect behavior from a close adult, usually the mother. Some of the most complex and lasting childhood traumas come from unhealthy parenting styles, such as placing too many expectations on the child to compensate for parents' failures, treating the child as too precious and spoiling them, ignoring the child emotionally because of personal problems. There are three main types of harmful parenting behavior: overprotection, hypercontrol, ignoring the child's physical or emotional needs, emotional coldness from family members, especially the mother, sometimes the father. A child builds their personality based on their parents' views. They learn about themselves from the way adults treat them. Unfortunately, these views are not always correct or beneficial. Parents usually do not harm their children on purpose. However, unresolved personal issues, often from their own childhood trauma, affect how they treat their child. Since parenting styles are often copied unconsciously, traumatic relationships pass from generation to generation. By healing your childhood trauma, you not only change your own life, but also help future generations build healthier relationships. How trauma affects personality development. When Sasha was 10 years old, her parents divorced. Even before that, they often argued. After the divorce, Sasha and her mother moved to a big city, and her father ignored her completely. Now Sasha is 32. She is not married and has no children. She often feels sad for no reason. She has few friends and avoids them for long periods. She feels guilty for disturbing others and often cries when reading books. Her mother says that before the age of 10, Sasha was happy, social, and curious. She changed completely because of her parents' conflict and divorce. As we see, Sasha's emotional struggles started with her parents' divorce, and especially her father's complete absence afterward. Young children have difficulty separating themselves from their environment. They believe that bad events happen because of them. For example, if their parents divorce, they think it is their fault. If they are bullied, they believe they deserve it. This is especially true for preschool-age children. As a result, childhood trauma creates a distorted self-image. Later in life, this can lead to low self-esteem, believing they are not worthy of love and success. Weak willpower, difficulty overcoming challenges. Distrust in people. Children also have little control over their environment, so they adapt to any situation, even unhealthy ones. Later in life, this adaptation can lead to serious problems. Psychological trauma and life activity. David was often sick as a child. His grandmother believed in making children strong by exposing them to the cold. While this worked for David's older sister, it did not work for him. He had pneumonia 7 times before he turned 6. He spent most of his childhood in bed. Over time, David began to enjoy the attention he received when he was sick. Even when his health improved, he avoided taking initiative and depended on others. He became very shy and insecure. By the age of 20, David had multiple psychosomatic illnesses. He did not study or work. His subconscious mind connected comfort and care with being a victim. Success and independence did not fit into his life script. It took him a long course of psychotherapy to change. The lasting impact of childhood trauma. As we see, childhood trauma strongly influences adult life. For example, a girl who was sexually abused may fear intimacy as an adult. A teenager who was bullied may become withdrawn. A child who had to fight for parental attention may grow up to be self-centered. In many cases, childhood trauma leads to difficulties in social and personal development. People who experience trauma as children often struggle with careers, relationships, and self-acceptance. Unfortunately, psychological trauma affects both the conscious and subconscious mind. A person shaped by trauma may not even realize it. To overcome childhood trauma, professional help is often necessary. A psychologist or therapist can help a person understand how their trauma shaped them and find ways to heal. Healing childhood trauma is not only a gift to yourself, but also to future generations. Vocabulary. Trauma. A deeply distressing or disturbing experience. Self-esteem. How much you value and respect yourself. Neglect. Failing to care for someone properly. Abuse. Treating someone badly or harming them. Bullying. Hurting or intimidating someone repeatedly. Therapy. Treatment for mental health issues. Coping mechanisms. Ways people deal with stress or trauma. Emotional distance. Being emotionally unavailable or cold. Overprotectiveness. Being too controlling or protective. Healing. Recovering from emotional pain or trauma. Quiz. Consolidate vocabulary. Self-esteem. A. How much you value and respect yourself. B. A type of neglect. C. A coping mechanism. How much you value and respect yourself. Neglect. A. Failing to care for someone properly. B. A type of abuse. C. A therapy method. Failing to care for someone properly. Overprotectiveness. A. Being too controlling or protective. B. A type of abuse. C. A therapy method. Being too controlling or protective. Healing. A. Recovering from emotional pain or trauma. B. A type of neglect. C. A scientific fact. Recovering from emotional pain or trauma. Listen to the video again to consolidate the new words.